Okay.
Great. Thanks, Casey. Good morning, everyone. It's great to see so many of you back with us again. And thanks to those of you who are joining us for the first time, some new faces. My name is Elizabeth Murphy. I'm the I'm the director of Creative New Jersey. And on behalf of my colleagues, Casey O'Brien, Jeanette Mitchell, Alyssa Calderon, and our leadership team chair, Larry Capo, who's with us today, we'd like to welcome all of you to today's briefing. As Casey was just mentioning earlier, today is the 7th briefing that we've done in a series of statewide community conversations on the COVID-19 response in New Jersey. So we started these briefings on April 1st. We've been doing them every Wednesday. We'll hold a call next week, which will be on food security and access. The last Wednesday of May, we're gonna take that week off. We're gonna catch our breath. And then we're gonna come back again and we're gonna do 2 more calls on Wednesday, June 3rd and Wednesday, June 10th. So we'll share out information with everybody about the focus of the calls. We're really grateful to our colleagues and friends at Springpoint Senior Living and Age-Friendly Englewood who have agreed to share with us today. The topic of today's call is resilient senior living during the pandemic. So just before we introduce our first speaker, let's just take a moment, right? We've been doing this for the last couple of weeks now. Let's take a deep breath. Just bring our attention into the center of our Zoom room. You know, Casey and I were talking earlier just about, you know, all of us are feeling Zoom exhaustion. I think I've said that new word, right? And that, you know, folks are saying it's not as if we didn't have a lot of meetings and pressure to some extent before the pandemic began. But the fact that we are not able to gather in person means we're also not able to benefit from, you know, benefit from each other's energy, right? It's harder on Zoom to actually use each other's, you know, life force to kind of boost us up and keep us going. So, so we just want to recognize that. And thanks for being present today. We want this to be a conversation, so we want to hear from you. As Casey mentioned earlier, all of you are connected to other networks around the state, right? So we're trying to help continue to create that environment where all of us can talk about the critical issues, where we can continue to build networks, strengthen those networks, help foster cross-cultural and cross-sector partnerships. And ultimately, we hope that helps us to build better, equitable, community-based solutions. So thanks for being a part of that work with us and for being with us today. So now it's my pleasure to introduce Michael Oakes. Michael is Senior Vice President at Springpoint Senior Living Foundation. So Michael's going to talk to us a little bit about, you know, how seniors are being affected by the pandemic, and he's got a good statewide view on that and some resources that might be available. So we know that, you know, all of us at some point in our lives, if we don't currently, we have seniors who are really, you know, mature adults who matter.
I think Elizabeth's video has frozen or her connection has gone a little bit. So I'll just step in while we wait for her to come back.
So, you know, we don't need to be a nonprofit that's here. Yep, I think I might be back.
There we go, now she's back.
Yeah, sorry everyone. So without further ado, let me turn it over to Michael Oakes. Michael, thank you so much for being with us today.
No problem. Thank you, Elizabeth, and thanks to everyone for joining. I definitely plan to learn as much as I hope to give knowledge about what's happening in our communities. Just really briefly to give you an idea of who we are, Springpoint Senior Living, we're the largest nonprofit provider of senior housing in New Jersey. We're in 12 counties. We have 8 continuing care retirement communities. And if you don't know what those are communities where you move in independent living, but then everything is kind of all encompassing on that campus. We have a clinic, we have healthcare, we have rehab, you know, all of those things. So you move on to one of those campuses in those 8 CCRCs, and that's really where you're going to stay. We also run 19 affordable housing communities communities throughout New Jersey. And as I said, we're in 12 different counties. So those affordable housing communities are subsidized by HUD. So what we do in those communities is it's only for seniors. It's for seniors who are living at or below the poverty level in that specific community. So what's interesting about kind of the two sides of our business is that we deal with seniors a little bit more on the higher end, if you want to say that, and then our seniors who are struggling. And in all honesty, most of our communities are really at the low end of the poverty line. So I think the challenges are the same in the communities for those seniors, but how we deal with them is maybe a little bit different. So I'll speak to both sides of that. I think the biggest thing that we've seen as a challenge so far is social isolation, especially as we get further and further into this. Within our CCRCs, some of the things that we've done are really just constant communication with the residents, with their families, with our healthcare providers in those communities, with our employees, just to really make sure that everyone is on the same page. They know everything that's happening. We've even been reporting in each of the communities the amount of people that have COVID, the amount that have passed away from it, the amount of employees that have it. We're really, I think if you see the news, it's not always the most complimentary with senior care, and more so nursing homes than what we do, but we're sort of all kind of looked at under the same broad brush. So we have been overly communicating as much as possible. And I think you can do that within our affordable housing communities as well. And some of the ways we've done it in those communities are certainly posting messages and trying to be as communicative as possible with them. What I think is one unique thing, and I was telling Elizabeth about this, is our affordable housing communities, they lie all over the state. And one of the things we've really done is tried to connect them with local schools and local children, and they've kind of become pen pals. One really great story is in East Windsor and in Heightstown. There's a really big, if you don't know, there's a really big Mandarin speaking population in those communities. And we certainly have that in our affordable housing communities there. And obviously the schools around that have some of those resources as well. So the schools have picked up and have started to use that as a way for the kids to practice writing their Mandarin and practice doing those things. So they've been writing letters to our residents in the affordable housing communities, and then they are writing back. So, it's kind of a nice thing that has come out of this. It helps the kids learn. I think, Elizabeth, as you spoke about, the kids are a little bit tired of Zoom as well. At least I know mine are. I have 4 kids at home on Zoom all day long, and they're done with it. And I think that really gives them an opportunity. We've had wonderful letters that I've seen where the kids are taking pictures of themselves and what they're doing and sending it to the residents. So it's really something that we hope kind of continues after that. But I think anything we can do on the social isolationism side is really going to be helpful in the future. We've done, so my charge is to raise funds for those communities and within those communities. And we've been doing handwritten notes to our donors. I've given our major gift officers the ability to do quick 1-minute videos that are very personal to our residents. They can address them, they can talk about them, they can kind of let their personality and their relationship with that person shine through. And it's a really easy app that they have on their phone. They take the video and they email it to the person. And we've gotten wonderful feedback on, it's just good to see your face. It's just good to the cards are nice and those things are great, but it's just good to see your face as well. So I think that anything we can do around that, I think, is helpful, and all being creative as possible. I'll talk a little bit. I didn't realize next week was food, but I think one of the other challenges that we see in both communities is access to supplies. Clearly more so in our affordable housing communities than in our CCRCs, because we're bringing those things into that community. But certainly in the affordable housing communities, access to supplies has been a difficult thing for us. Fulfill, the Monmouth and Ocean Food Bank, has been incredible for our communities in Monmouth and Ocean County. We partnered with them. We've partnered with Mercer Street partners in that end of the state. So, I can give Casey some of the resources that we've used. I think it's really it's difficult to forge partnerships now during this because everyone's kind of running around, but certainly we are leaning on the partners we've always had and just needing more from them than we have in the past. There's also local restaurants. I'm not afraid of looking on Facebook or on the social media where restaurants are saying, hey, we're giving meals to first responders, and reaching out to them and saying, here's the situation in your community. We have 80 seniors who are not allowed out of their apartments and they can't go get groceries, and some of them aren't able to cook for themselves. Do you have the ability to give to us as well? And some do and some don't. The other thing we've been able to do is write a few grants during this time to help pay those restaurants to continue those resources. So, we've been pretty active as much as we can be in that. And we actually have reached out to a few local farmers as well who may have some excess. So we have actually 4 communities right now on the affordable housing side, all over the state, Union County, Monmouth County, Mercer County, who are getting monthly deliveries of fresh fruit and produce from a local farmer here in New Jersey. He's in Hightstown, and I can give you him as a resource as well. So I think those are good things to think about. It's been a wonderful opportunity for us to just reach out to many different organizations and see how they can help and how we can help them. But that specific program has gone really, really well for us. And aside from the access to supplies, I think the increase in the dollar amounts has been really, of what things cost, has been really a struggle in our affordable housing communities, certainly. So it's difficult to get to the grocery store. It's wonderful that a lot of the grocery stores are doing early hours for seniors. But if they actually talk to at least our seniors, they're saying, we aren't necessarily up that early and able to get out and go and really be ready. So, we are trying to provide transportation for them to get back and forth to the grocery store. But even when they get there, everything's a little bit more expensive. So one of the things that we were able to do from the foundation, and we reached out to our board to make sure that this was okay, is we were actually able to provide, right in the beginning of March, when we knew this was kind of coming down the pike, dollars for an emergency food pantry in all 19 of our affordable housing communities. So our board allowed us to use some unrestricted dollars to be able to help in those communities. So we stocked that immediately. We've done kind of 2 rounds of restocking, but it just gives the seniors in those communities a sense of safety, a sense of, if I really do need something, I can walk downstairs and have access to it, as opposed to, having to figure out how to get to the store and being worried. And do I have a mask? And am I able to provide, the protection to other people and to myself that I have? We've been able to reach out to a lot of our vendors on the cost of things. So for the nonprofits that are out there, to just say, can you help us with either no cost or very low cost supplies for our affordable housing communities? So we've been able to get masks for each of our residents, and that's, it sounds silly. I'm hoping everyone on the call has it, but if you look at some of our communities, that access to those things and the cost of masks, I mean, it's $5 for a mask, which for some people might not be a lot, but for those living on a fixed income, that's a significant amount of dollars, and it's something that they have to change, right? It's not something that they can just buy once and have forever. So, it's changed the way we are reaching out to our vendors and asking for help. In our communities, as I said, we're on the very low income side. We have a community up in Plainfield Tower, where we're doing the fresh fruit and produce, and we have the emergency food pantry. But when you look at that community, the average annual income for the residents is $7,000 annually is what they're living on. So any slight increase, which we're all experiencing now, is harmful to every single of the 183 people that are in that community. That's a significant portion of what they have to live on. So that's something that we're always trying to be mindful of and trying to reach out to whomever to help us with that. I think aside from, kind of the increase of cost of supplies, and I know you've touched on this too, but certainly social isolationism and the high anxiety that our residents are experiencing, both in the CCRCs and the affordable housing communities. Your income has nothing to do with how you're feeling mentally. There's different levels of it, certainly, but we absolutely have that high anxiety in those communities. So a couple things we're doing within our CCRCs, we have access to their TVs, and we have a channel that is kind of Springpoint centric, and they have been, Elizabeth, very similar to what you did in the beginning of the call of, can we just take a minute and close our eyes and take a deep breath? I mean, that matters. That can recenter people. And we've been streaming yoga classes and just different opportunities for people to turn off the noise of the news and everything that's happening out there and really just come to, you are okay, you are safe, we are taking care of you, we are going to be here through this no matter what. And just try to kind of bring that into focus for the seniors, because all they're hearing, we're hearing it as well, but they are processing the information differently than I am. Certainly at different stages in your life, you process it differently. So you're looking at all of these senior care communities who have this huge surge of illness and death, and thinking, oh, is that coming to me next? And regardless of all the communication we have, you are alone in your apartment, or you are alone with your spouse in your apartment. And that is a lot of time to think about those things and kind of get that heightened anxiety. So we have reached out to our own, as an employer, we've reached out to our own benefits administration, Aetna, to say, what can we provide in the communities, both for the employees and the seniors that are living there, as well as Monmouth Health Associates has been phenomenal with us and doing some Zoom calls and other things for our seniors. So I think anything that you can do to kind of stave off that high anxiety that they're certainly experiencing, then I think that's beneficial to everyone. And then the last thing for me, sorry, I went over my 7 minutes, but the last thing for me is certainly reach out to your board. If you are a nonprofit, we have a corporate board as well as a foundation board, and we've received resources from them that they never thought they would have a connection with or be able to do. And that's something that has been really important to us, and they want to do something. In some ways they feel helpless as well. Sure, they can give dollars at this time, but in some ways, and we can use them right away, but in some ways the resources are just as important, because we want to be able to continue those relationships. Your local Office of Emergency Management has also been wonderful to reach out to and be able to get some resources from. So your board and just kind of that local area around you, this is not the time to be shy to ask for help and to highlight your mission and what we're doing. I think that's it for me.
Michael, thanks so very much for sharing all of that really helpful, important information. And I think, I heard you say so many things, but one of them is really about that interdependency between, things that some of us might take for granted, but when we're in crisis, vulnerable populations are feeling the crisis in a myriad of ways. And things are so interconnected and so interdependent. And when one thing is stressed, it can actually cause everything else in somebody's life to sort of cascade downward. And but I also heard you talk about a lot of opportunities, like really some very interesting ways where all of us could sort of play a part in helping seniors in our own part of the world, right? Like whatever that might be. So
Absolutely.
I want to turn it over. Casey's going to moderate this Q&A. I'm hoping that some of our folks, got some, want to share some of their thoughts with you, Michael, before we turn it over to Janet. Casey, you want to
Great.
get away?
Yeah, thanks, Elizabeth. Just as a reminder to folks, if you're on the video call with us, you can drop your question into the chat function. You can also raise your hand in the participants section. And I see one participant is already on it, so that's great. And also, if you're on the phones with us, you can *6 to unmute yourself. I do see one question up here right now. So Arlene, if you want to go ahead and unmute yourself and ask your question.
I'm sure this is a way of communicating. I'm Arlene Romoff. I'm an advocate for people with hearing loss. I myself am deaf and I have cochlear implants. I wanted to make you aware that in the senior population, about half have a hearing loss. And the fact that Medicare does not cover hearing aids means that they probably don't have hearing aids. With masks on, everybody is deaf. Everybody, okay? And the cultural, the behavioral traits of somebody who is having difficulty hearing is they will fade away. So the ones you hear from least are the ones who can't hear the most. And I would really like to just brainstorm with you some practical, creative problem solving to address this vulnerable population, because isolation is deadly. And not to be able to pick up a phone, for example. They just don't know how to communicate. They can't hear, they know they're going to be able to understand. And that just makes the situation worse. So I have a few ideas in mind, and I'd be really happy to connect directly and maybe just work up some kind of fact list for other residences like this that are facing similar challenges. I have a wealth of knowledge and experience in this, so I think that we could really put forth some things that could really actually impact people's lives immediately. You know, as simple as holding up a sign of what you're saying on those morning breathing exercises. If you can't hear somebody say breathe, you're not going to breathe, all right? So that's just an example. And of course, there's more where that came from. So I have your email. I'll shoot you an email and we can follow up.
That would be great. I would love to brainstorm that with you. As Elizabeth said, sometimes you don't even know who you're missing, right? You're doing your best to communicate and over communicate, but still doesn't mean everyone's hearing you, or they're not hearing you in where they need to hear you. So I think that'd be great. And hopefully, obviously we'll Casey, I'm sure you'll post it for everyone once we can talk about it.
Okay, and just remember, hearing loss is an invisible disability. You cannot tell. And the ones suffering the worst are the greatest bluffers.
Yeah, thank you, Arlene. Thank you for that. And yes, Michael, certainly Arlene's got your email, and we've known Arlene for a number of years, Elizabeth particularly, and her advocacy work around, you know, folks who are hard of hearing or deaf. And so when she says she has a wealth of experience, it's definitely true.
And I'll just say one other thing. I'm so sorry, Casey. I'll just say one other thing. So Michael and Arlene, you are 1 degree separated by John McEwen. So I'll know that, okay? Our friend and colleague, John McEwen. So, and the Theater Alliance. So anyway, you'll connect, but I wanted to let you know that.
Right, and this is what it's all about. These interconnections here. So I see another question from Nancy in the chat box. Michael, what are the resources for people who cannot afford the graduated care community, but whose income exceeds the limit for low-income housing? Do you have any thoughts on that or any experience with that?
You know, I do, but I don't know that I have them off the top of my head. And certainly we get these questions a lot because there are plenty of people who don't qualify to move into our affordable housing communities. And us as a nonprofit and our mission to help those, we don't just say, well, sorry, you can't move into ours, so good luck with that. We do have some resources. So let me get with our director of affordable housing. Her name is Listra. And ask her to give that to me. I don't know off the top of my head, but I know we don't just say, good luck. We do give them some other resources, but it is difficult. I met a gentleman last week at Plainfield Tower who waited 3.5 years to move in. Most of our communities have a several year waiting list because there's not enough affordable housing. And he was paying an exorbitant amount of money of what he had to live where he was. So yes, I know we have some resources. I'll get them to you, Casey.
That's great. Thanks. And we'll be able to share that out in our summary to everybody here as well and put that up on our website. There's sort of a follow-up question to that one. Are there resources to help seniors, say for this speaker who's 74, to assist people with property taxes and reasonably priced home repair? Again, I don't know if that falls in your wheelhouse or not.
It's not, but it's certainly, we will ask the question. Ours is more based on state regulations and some of those things about when we do repair and those things, but there are certainly resources out there just being in senior living that I can get to you. Absolutely.
For what it's worth, for Nancy and for everyone else on the call, when we were doing our call last week or two weeks ago on mental health during the pandemic, there were a lot of resources through the Division of Aging at the State Department that may be a place for you to find some of that information as well. So it might be worth checking out the State Department's Division of Aging. And certainly they work very, very closely with a lot of the other divisions within the Department of Human Services at the state level. I see another question here. Are there things that faith-based organizations can do to support nonprofits that may be providing food and other supports for seniors?
Definitely. I think we have some partnerships with Presbyterian churches. We used to be, Springpoint is our current name, we used to be Presbyterian Homes. So there have been those that have food pantries and other resources in their local community that we've connected with our affordable housing communities. So if they have something that they're doing now, certainly we have the opportunity to connect those as well.
Great, thank you.
Casey?
Yes.
I can respond to the one question about property taxes and about home repairs. Property taxes,
great, thanks, Janet.
The senior tax freeze that you can get through your local municipal office, the tax office. You can get a freeze on your taxes at the previous year if you meet the income requirement. And also for home repairs, there are a lot of services in various counties through the Area Agency on Aging. I know in Bergen County, there's the tour service. There's also Rebuilding Together North Jersey, and also some community development do have things that they can do home repairs, like put in ramps or broaden doorways or things like that. So there are resources out there.
Great, thanks, Janet. Elizabeth, I'm going to turn it over to you to introduce Janet, even though she's already introduced herself, which is wonderful.
Great. So thanks again, Michael. I know everybody joins us, and thanking you very much for your time and for being with us today and for the additional information that you're going to be able to share with us. So now it's my pleasure to introduce Janet Sharma. Janet is the coordinator for Age Friendly Englewood, but Janet and I first met each other right after Hurricane Sandy, when we were all working together to help communities rebuild after.
Oh, looks like Elizabeth's video is a little choppy today, so she'll join us in a moment. I know that Elizabeth had worked with you, Janet, during the Hurricane Sandy recovery. Okay, she's back. Great.
Yeah. Thanks, Casey. I'm so sorry, everyone. My connection's a little unstable today. Yeah, so Janet and I worked together in the aftermath of Hurricane Sandy as we were working to help communities recover. And at that time, Janet was the executive director of the Bergen County Volunteer Center, doing really important, amazing work for folks up in Bergen County. And she retired, and now she's with Age Friendly Englewood. So Janet, it's really good to be connected to you again. And thanks for being here. And I'm going to turn it over to you.
Okay, great. Thanks, Elizabeth. I got to tell you, Zoom is a lot more fun when there's a baby on the screen. So I love looking. I don't know the woman who has the baby, but I love it. Also, I retired in 2015, and right around then is when there was an initiative ramping up by two local foundations in New Jersey. One was the Henry and Marilyn Taub Foundation, and one is the Grata Fund. And I see Rennie Kerniel is also on this call, who heads the Grata Fund. But they put out an RFP for communities to form coalitions that would help people age in place. So as I said, I had retired, but I already knew a lot of people in the Bergen County area, and Englewood in particular is very close to where I live. And there are a lot of really well-functioning nonprofits in Englewood. It also has a very mixed, very diverse population and a lot of low-income people, a lot of poverty. So I thought it was a likely community to form a coalition to help people age in place. So we did that. And we got a planning grant, and then we got a continuing grant. But the first thing we did was a community survey to find out where were the gaps in service and in other resources in the community. And one of the biggest things we found out is that there's a need for information. Bergen County is kind of in a media desert. We don't really have a functioning local paper since the record was bought by Gannett. There really isn't much local news coverage. So we started doing a newsletter, and that got very well received. And we also did a directory of senior services that sort of pulled together all of the resources that were available for hundreds of different organizations, and we put them all in one book. And it wasn't just a matter of putting it on a website, because a lot of the people we were targeting weren't comfortable using the internet, didn't have a computer, whatever. So we did a printed directory, which we've now got about 4,000 of those in circulation, and they're very well received. And now the local hospital was going to be reprinting it or redesigning it, but they're busy right now, so they're not doing that, but they will eventually. And then as years progressed, we got more involved in the whole network of nonprofits and providing different programs that were specifically targeted to seniors or for other people in the community or work with seniors to get them more engaged in the community. We had projects that we had developed for the months ahead that included concerts at the library, a public art project, a pedestrian task force that would work on walkability and getting more benches around town, promoting a doo-wop concert at Bergen PAC for Older Americans Month, which was going to be this Saturday, putting in a community garden at the low-income senior building, doing blood pressure monitoring with the Department of Health, and putting together with the community chest a mental health conference that part of it would address isolation in seniors. And then we were doing a bunch of intergenerational programs with a local organization that runs a program in the high school, and they were going to be working with seniors in their agency as well as in the low-income building. So all of those are now on hold. But we did find that to be specific, on March 13th, Friday the 13th, when things pretty much shut down, we had already done a newsletter for that month, but there was so much happening all at the same time. I started doing a newsletter every day. And it turned out that every single day, there were more things happening, more online resources, more food distribution things going on, a lot of things coming from the governor's office, from the county executive, from our local mayor and council, and all of these things that there was no place for people to get that information. So I started doing this daily newsletter. And every day, and I subscribed to the Wall Street Journal, which you can get for $1 for 3 months, and to a couple of other local papers. I already had the New York Times and the Bergen Record and NJ.com and New Jersey Spotlight. So I just pull all of these resources together, which probably in a lot of ways it's illegal, but I'm doing it anyway. I'd rather ask for forgiveness than permission. And every time I try to put in a little something that is inspiring, and I love John Bon Jovi. And so of course I found a video of him from that Rise Up concert. But we put in a lot of things that are available for older adults, things that are available now about testing and about contact tracing, and things that are going on from a lot of resources from AARP that we pass on, things about food, about masks, about patronizing our restaurants, or if you need food, there are a lot of different resources for food out there. That the little box that you just saw go by, that was one of the local organizations that has been providing food for has been providing shelter for homeless families for years, Family Promise. They connected with World Central Kitchen, and they've come in now, and World Central Kitchen will pay restaurants to make food for local people. So it's a really nice partnership, and they're giving out it's prepared meals that are frozen, and they hand them out, I think 400 a day at the St. Cecilia's Church in Englewood. They're doing that for the next 2 weeks. So we're just trying to get all of this information out there. And it's been very successful. We get read by about 600 to 700 people every day, and there have been 42,000 now people who have looked at this information. And I did a little survey to see if it was valuable, if people really wanted to get it every day, or if it was too much, and 100% of people said they wanted to get it every day and that the information was useful. So we put together that takes up a good deal of my time, but there's also this whole network of social service providers in Englewood that already existed. And we have a call every day where we just sort of network and find out who needs what and what can we do with resources. We found out, for instance, last week, we had a couple of the principals of schools, the middle school and the high school, were on the call, and they said when the school shut down, they asked everybody, and they knew they were going to digital learning. They asked all the students if they had access to the internet and if they could do work online, and they said yes. Well, it turned out they had their phones, but you can't really do a term paper on your phone. And a lot of them didn't have Wi-Fi at home or a computer at home. So they've gradually been getting laptops and Chromebooks out to the students so everybody has something to work on. And now we're working on, and I was able to connect them with some contacts I had from back in the days of Hurricane Sandy with Verizon and some other providers who provide disaster services like that. So hopefully that will help. But things like reaching out to people who are isolated, that's the hardest thing, is we don't know who we don't know. So we've been trying to encourage people to look in on their neighbors and to find out if they would like a friendly call. We are enlisting people to be volunteer callers in addition to what the fire department does every day, which is just a check-in to make sure somebody's awake and alive, but it's not really a lot more than that. If they connect them with emergency services if they need them, but they're not there to chat. So we have about 25 or 30 people who have signed up to just be friendly callers. And now we're matching them with people who have indicated that they would like a call. And they're not as many of those people as we thought they would be. We're also enlisting people to help others with technology. If there are a lot of older people who have an iPhone but don't know how to use it and can get very confused using it. Same with their computers. So we have people who are volunteering to help them over the phone with their technology, and that's also been very successful. We also found out there's this thing through the post office called Every Door Direct, where you have to have a specific size of a postcard and you have to bundle it a certain way, but it will be delivered to every residence in town. So we sent out something of that. It's in the process right now. It's from the mayor and council and from H. Friendly Englewood. And it's just connecting them with different resources that are available in town by telephone or online, and also asking them if they would like a friendly call or if they need other services to just let us know so we can respond to them. So again, it's really just working with the network that was already there to find out what still needs to be done and where are there gaps in service and how can we rely on each other to get help to seniors. So that's basically what we're doing, is just sort of working on the connections we already had, but hopefully heightening them and expanding them to reach as many people as possible. And not just seniors. There are plenty of people who are single or isolated, or people who are, moms at home with their kids and they just need resources. So we're working every way we possibly can to help people. Englewood is very much, it's kind of like New York City in that it's very much a community of neighborhoods, where the neighborhoods, whether it's built around a geographic area or it's a neighborhood of a church or a synagogue, that they're very well interconnected within that neighborhood. So we're working that too to make sure they reach out to people, that they reach out to people who live next door but are not in their church, but to encourage them to look in on their neighbors one way or another. So that's basically what we're doing. We're just working everything we possibly can to try to make sure everybody gets what they need. Food has been a big thing. But besides the World Central Kitchen that's come in just this week, the recreation department took on the challenge of getting food to kids who got subsidized meals at school. So the recreation department is stationed at several locations in town every day where people can come and pick up food. But then they also have expanded that, so they have restaurants that provide food, or table to table, which I don't know if table to table is statewide, but they will also come in and provide boxes of food. So that's, anybody can come until the food runs out. There's no income requirement. It's just, if anybody needs food, come and get it. And the Center for Food Action also does that as well. So we don't know that there's anybody who's not being fed, but of course there could be, and we just don't know about them. So again, we're just trying to work all angles to find out who's out there who still isn't getting services. So we'll hopefully find all those people, but it's a continual challenge. So that's us.
Yeah, thank you, Janet. Thanks for sharing all of that information. Do you know, I think one of the things that I heard you say is that it's so critical that we continue to share and reshare information,
Yeah.
right?
Yeah.
It's just critical.
It is, because people
sharing.
don't know you need a service until you need it, and then you need it immediately.
Right.
I'm finding that with my sister, she lives in Texas, and she is in failing health, and all of a sudden she needs a lot of services, and she's not able to access them herself, but she needs it right now. So I'm talking to people in Texas. But that's true for anybody. You don't know if your child gets sick with something, you need it right then. You don't want to wait. So whatever it is, it's got to happen when people need it.
Right. Such an important point. Thank you. Casey, I'll turn it over to you to moderate our Q&A with Janet.
Great. Thanks for that. Just again, as a reminder to folks, raise your hand in the participant section if you're on video, or drop your question into the chat function. And if you're on the phone lines with us only, you can *6 to unmute yourselves. I would also, just to this point of sharing and resharing information that we just mentioned, encourage any and all of you on the call that if you know of other resources that are working in your town or region to help with things like transportation or food or wellness checks, drop those links, drop that information into the chat right now, because again, all of that information will get aggregated into our summary, and then that will be shared out widely. So if you know of organizations or resources, please share them. This is only going to help us if we continue to, again, let people know so that when they need it, they're seeing it. I see a question here in the chat. This is from Christina that says, Premier Stages, which is a theater company that's based out of Kane University, has created a playwriting award for seniors living in assisted and independent communities. Who can I reach out to at Springpoint and age-friendly Englewood to get this information out to resident contacts?
Send it to me and I'll get it out. There are a couple of arts organizations in town that are still active. They're doing some Zoom stuff, but I'm sure they'd be interested in that.
Absolutely, same.
Great. So
we have 5,000 seniors that we can get it to pretty quickly.
Yeah. Also, we have a very active library that's put together a very good online program. They do a variety of things every day, and that might be a good place to. And they get a lot of traction as well, so that would be a good place to reach out for that, for the playwriting.
And just to clarify, Janet, are you saying the Englewood Library or a library that's?
No, the Englewood Public Library, yeah.
Okay, great. Wonderful. If there are any other questions, and Christina, just as a reminder, their contact information has been dropped into the chat function that will in fact be shared out as well. So if you can't find it, let me know and we'll make sure that we get it to you. Okay, Ellen, I see you have a question. If you want to go ahead and unmute yourself and ask your question.
Hi, everybody. Sorry for the distracting baby.
Oh, wonderful.
One of the things we've been doing, I have the Music Moment, a private practice for music therapy, and we've been delivering singing telegrams. So that is just something where somebody can call in and say, hey, I want to call this person with this song, and we deliver a song message, and that person can be on the call as well, and we can schedule that. So it's just something to bring a little love and spirit, a nice message of hope, whatever people want to share with their loved ones. So I just wanted to share that. I'll put in the chat my contact information if anybody's interested in more about the singing telegrams.
Terrific.
Great, thank you, Ellen. And Zoom babies are welcome. This is the world we're living in, and we make room for everybody for sure. So yes, if you can show that, that would be great.
It's exhausting.
I'm sure. So I just want to ask the folks on the phone if they have any, just give them a moment to hit *6 to unmute themselves if they have any questions that they want to ask. And then, of course, if you also have a question that you want to drop into the chat function or raise your hand for, we can do those. Elizabeth, if you wanted to jump in and say something.
Yeah, thanks, Casey. So Janet, I just wonder, do you know if there are other organizations like Age Friendly Englewood who are operating in different communities around New Jersey? I mean, it just sounds like the work that you're doing is really strengthening the connectivity in Englewood, and I'm sure that adds to the community's resilience.
It does. It's been really beneficial in the communities where they're in place. In Bergen County, they're in Englewood, Teaneck, Ridgewood, Westwood, and Garfield. And a new one is just starting up in Fairlawn. And then in other counties, there's South Orange Maplewood, which is one. Another one is Tri-Town, which is the Chathams and Madison. And and Elizabeth is another one. And then Montclair already had an age-friendly initiative that's now been taken over through the city of Montclair. And Princeton also has an age-friendly initiative. Those are the only ones I know about, although there may be more coming online. Rennie, I see Rennie is here, and Rennie Carniel runs the Grata Fund, and she can add to that.
Hi, Rennie. Thanks for joining us today.
Hi, thank you, everyone. This was a great conversation and one that's very important. The Grata Fund for Senior Care, as Janet mentioned, has been funding Age Friendly along with the Taub Foundation. There are lots of resources on our website as well as the Taub Foundation website, so please go there. As Janet mentioned, the 3 communities that we're funding and 2 new ones, the town of New Providence, as well as Livingston. So each of these communities are jumping on board to help with whatever is happening and needed in the towns, working with their mayors and nonprofits. One group for home repair, for the person that was asking, is a group called Umbrella. It's a new group in northern New Jersey that's reaching out. They changed their model to be more responsive to the communities and be able to help people right away. So take a look. In addition, what's helped really tremendously in Essex County was through our Age Friendly initiative and a Jewish Family Service social worker, is we were able to actually get in Meals on Wheels into some public housing that previously had not been able to bring those services locally, as well as do a GoFundMe to provide resources to people that are reaching out and needing services in the community. So tremendous amount of response. In Chatham's and Madison, there's a huge response with helping with shopping and other services that are needed in the community. What's happening is the Age Friendly coordinators are becoming the coordinator along with the mayors and the services to make sure that services are reaching out and that partnerships among nonprofits are happening. As Michael said, sometimes it's hard right now. So the good news is where these communities had established relationships, they're now strengthening the relationships. In the city of Elizabeth, that obviously, as we all know, has lots of issues, and food insecurity is a huge concern. The Jewish Family Service of Central New Jersey is actually looking for food. So those of you that know of food that can be donated, their pantry is as fast as they can get the food in, giving the food out in packages and bags and in deliveries. So that's in Elizabeth, really quite needed, along with working with public housing to do some social isolation concerns, especially with grandparents raising grandchildren. This is a concern that Ellen, I see you with your child. I think a lot of folks that are raising their grandparents are also struggling with the challenges of grandchildren. So we're seeing a lot of different activities through our age-friendly communities that are beyond the scope of just looking at the normal domains of living and really pivoting and benefiting by the expansion of the partnerships that they created over time. The last thing I want to mention is that Trinitas and Jewish Family Service are now working together so that community health workers can go out and help former hospitalized patients get resources when they go home from the hospital, which we're now finding more of. It's a wonderful situation to have people going home from the hospital, but many of them are challenged to have food and other supplies that they now need at home, and as well as the need to take care of their loved ones who are definitely still challenged. So Janet has been a tremendous leader among our age-friendly leaders. The collaboration among the teams is great. Stay tuned. We will be running our conference. It was supposed to be in March through 4 virtual sequence of sessions starting in September. And we hope to not only spur communities to build these collaborations, but also at a statewide level to look at policy issues like those that several of you mentioned about housing and food access that we know are issues.
Thank you, Rini. Thank you so much for sharing all of that. Really appreciate you being with us. And I wonder, a question for you and Janet. So if we've got some folks on the call who are interested themselves or might know of some, have some colleagues who are interested in starting an age-friendly organization in their own city or town, how, can they go to you guys for some assistance to figure out how they get that started? Like, how might they?
There's also incredible resources with Livable Communities, which is a facet of AARP. They have enormous resources to help, all sorts of tools and toolkits to help you get started with a community survey or with all sorts of different things. I think they have several workbooks that are available for free about all sorts of things having to do with age-friendly initiatives, and that would be a really good resource. And certainly contact me or Rennie, whatever, it's fine. We're always happy to share.
We're happy to extend the resources and be sure to go to our pages. There are pop-up opportunities for grants, so stay tuned to those opportunities, both occasionally through us. We have a schedule of rolling these out, but there are other sources we hear about all the time. So please feel free to reach out to us. I put my email address in the chat box.
Great, we see that. Great, thanks very much. We know we're coming close to the hour. Does anybody else have a comment or a question for Janet or Michael?
I see one here, Elizabeth, that has to do more with what kind of resources are there for affordable housing, particularly for seniors in South Jersey. I don't know if anyone can speak to resources or places where people can go to find out information. In this one particular instance, this individual is worried about a neighbor who has a dog who might be getting kicked out of her apartment because of the dog, even though it's listed as a care dog. So looking for affordable housing way down in South Jersey, Cape May, Gloucester, Salem, that region. Is there a place where individuals could be directed to look for other places for living?
There is, and I can send you the resource for that. We have, as I said, we're a little bit all over, not in either of those. We're in Burlington and Atlantic County. If anyone is looking specifically for that, they can go on the Springpoint website. But I'll send you a site, Casey, that you can post for the affordable housing in New Jersey.
And that's
Great.
a critical problem, and I think it's everywhere that people are desperate for affordable housing and they don't know where to go. I think Maureen McCormick was on the call. I saw her name anyway. She was designated as the housing navigator for Bergen County, and she keeps track of what kinds of housing are available, what do the applications do, how can you get the application. I mean, it's a tremendous resource that they had to do quite a bit of arm twisting to get the county to initiate that position. But I think it's really invaluable. It would be great if every county or region could have the same kind of service. It's really important.
It is great, especially for those that don't, one, know where to go, but two, to get applications in quickly. Our average is 3-year waiting. Some of our buildings have a 7-year waiting list. I mean, there's not enough of them out there, and we've added one in the last year, but even that's not enough. So we'll get you the resources. I think there's just such a limited supply, especially on the affordable housing side.
Yeah.
Great, thank you.
Maureen, did you want to say something? I think we saw that.
Yeah, I unmuted. Hi, Jan.
Hello.
Yes, we have information of buildings that I have identified so far in Bergen County that are at least taking wait list applications. Unfortunately, in Bergen, there's little to none. Here's an affordable housing or subsidized housing apartment, walk right in. They're all on wait lists, and depending on the age, the newness of a building, there are buildings that are going up now. It could be anywhere from a few months to like 10 or 12 years in terms of wait list. But I do have that document. It's called Navigator Notes. We update it every 3 to 4 weeks. More often, if I find out something new, a new building, a new deadline, and so forth, I guess I can just type in on the chat how to, contact me and ask if to be put on my email blast list.
Great.
That would be great. Thank you.
Again, it's just Bergen County.
Yep, that's okay.
Bergen County Division of Senior Services, but I'm happy to share that.
Right.
That's great. Thank you, Maureen.
And if you
Sorry,
send,
Elizabeth.
that's okay. Sorry, Casey. If you, Maureen, if you want us to include any other links or information in the summary report that we will send out tomorrow afternoon of this call, feel free to email Casey or me or Jeanette or, you know, any of us. We'll put our email in the chat function.
Okay, great.
Okay, great.
Now, we do have one other question from Paul, if we have time to take that, Elizabeth.
Yep.
I just wanted to remind everybody, June 1st is the beginning of whatever we're experiencing now with COVID-19 would get exacerbated tremendously by a simple storm. So we just need to keep our vigilance open and honest and stay aware. And again, working with seniors and wellness checks and stuff like that is very important. We're standing up an IRC for COVID-19. IRC is Interagency Recovery Coordination. So we're preparing for what they're calling a tail in September, October, and November. So just be vigilant. The work you're doing, Elizabeth and Casey and Alyssa and everyone else is phenomenal. I've been on every one of these calls, and I bring it back to the SITREP unit, which is situation reports, right up to the government, and that report goes to the president's desk, just so you know. So we're telling people what we're doing out here as a community. God bless you all. Great work.
Thank you, Paul. Thank you very much. I mean, you know, as you say that, I think, you know, so many of us on the call today have had the benefit of being connected to each other for many, many years, right? And so I think that building a resilient New Jersey, building a strong network of people who can, you know, continue to lift up our communities and make sure that nobody is falling through the cracks, right? All of us in some way are committed to that on this call today. And so, you know, for the new people who are with us now, thank you for joining us and building these new relationships and networks with us. And for everybody else on the call who we've had the opportunity to sort of work for many years together, you know, we certainly thank you for your continued partnership and collaboration with us. So
Okay, so I think that I'm not seeing any other questions, so we can probably start to wrap the call. Just as a reminder, we are going to be holding another call next week on food access and security. I'm going to drop in the registration links for that as well. Many of you on the call are already registered for that, but if you have any doubts, drop us an email and we can double check that. And then as a reminder, everyone will get an email with the links to the recording of this call, as well as an emailed copy of the written summary. All of those are always available on Creative New Jersey's website. I've just dropped our specific COVID-19 resource page into the chat box as well, but you can always find that just by going to our homepage on our website, which is creativenj.org. And Elizabeth, I'm going to turn it over to you for the last couple of words here. I know Jeanette's going to also be sharing some information.
great. So Jeanette, I want to just turn it over to you quickly so you can just say hello to everyone. Our team member, Jeanette Mitchell, many of you know Jeanette. Take it away, Jeanette.
Hi, everyone. It's great to be with you this morning. I am the program associate here at Creative New Jersey. I just wanted to drop our links for our social media pages and groups. We are on all the platforms, so that would be LinkedIn, Twitter, Facebook, Instagram, and YouTube. And of course, we have 10 separate groups that you can join into that, for example, it's like Ashbury Park and Atlantic City. So I'm going to drop the links. Thank you for joining us. And back to you, Elizabeth.
Thanks, Jeanette. So again, Michael Oakes, Springpoint Senior Living, Janet Sharma, Age Friendly Englewood. Thank you so much for being on the call with us today, sharing really important information. Thanks also to everybody else who contributed and shared information as well. Thank you, Rini, for joining us. You know, next week, as we mentioned earlier, we're going to talk more about food security and food access. We've heard a lot about food over the weeks, right? So, you know, again, like these issues are very interrelated. So we've got Right now we have 2 speakers lined up. We might have a third. We're waiting on some confirmation, but we have Alex Wills. And Alex is a friend and colleague in Camden. She runs Cathedral Kitchen in Camden. We met Alex when we were doing our call to collaboration community building work down there in the city of Camden. And we also have Mary Sellis. And Mary is with the Passaic County Food Council. Mary came to us because of our work in Patterson when we did our call to collaboration there, and our friend Inga from the Patterson Alliance connected us to Mary. So, so we're looking forward to next week's call to learn more about how each of us can sort of help alleviate the burden and the stresses that people are experiencing around food security and food access. If you haven't done your census, make sure you're doing it, right? Let's remind everybody in our world to complete the census forms. We're going to send out these notes at the end of this call. Many of you who've been on the call with us every week know that we're going to stop the recording in a moment, and then we stay on because if folks just want to touch base and let us know how you're doing, you know, we're a community, and all of you matter to us, and we know that you matter to each other. So, hope you join us next week. Thank you again to Janet and Michael. Stay safe, stay strong. Thanks, everyone.
Thank you.